It's Lindsay Smith-Rogers, producer of Public Health on Call. As 2025 winds down, we want to say thank you for listening, contributing, and sticking with us through another year of massive change and breakthroughs in public health. This season, we've explored how uncertainty can also mean opportunity, and how science, policy, and community continue to shape the world we live in. We've also launched a brand new Instagram account at Public Health Pod, where you'll find highlights, quotes, and behind-the-scenes moments, as well as ways to tell us about what topics you want to hear next. You can also send us your questions and voice memos anytime at publichealthquestion@jhu.edu. We're taking a short break for the holidays, and then we'll be back on January 5th with season 13 of the show. Until then, thank you for being part of this growing community. Stay curious, stay connected, and we'll see you in the new year. And now, on to today's episode.
Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
It's Lindsay Smith-Rogers. Today, a look back on attacks on healthcare workers in 2025. Len Rubenstein is the author of the book Perilous Medicine: The Struggle to Protect Healthcare from the Violence of War, and an emeritus distinguished professor of the practice at the Johns Hopkins Bloomberg School of Public Health. He joins Dr. Josh Sharfstein to talk about the major surge in violence against healthcare workers, including where, why, and how it can be stopped. Let's listen.
Len Rubenstein, thank you so much for joining me today on Public Health on Call.
Thanks for having me, Josh.
So I saw this article with some compelling graphics in the British Medical Journal called How Attacking Healthcare Has Become a Strategy of War. And I thought I would reach out to you to talk about it.
Happy to do that.
And now, for the audience, there's a reason I reached out to you.
Yes, I've been working on this problem for about 25 or 30 years, trying to both track what is happening and understand what's driving the attacks, and also to try to mobilize support among governments, health professionals, and others to stop the violence.
25 or 30 years is a long time to work on this issue. What got you involved in the issue of preventing attacks on healthcare during war?
It started when I was at Physicians for Human Rights in the 1990s, and there were wars going on in the Balkans, in Bosnia, in Croatia, Kosovo, in which hospitals were continually attacked. And we investigated those attacks, and then investigated attacks in Chechnya, in the West Bank and Gaza, and other places in the world. And I saw that these were very frequent, and not much was being done about it. And just a few NGOs were tracking these attacks. And the WHO, for example, didn't have protection of hospitals as a priority. So we felt that something more had to be done. And I started doing more and more work on it, writing about it, urging WHO to become involved in collecting data on it, which of course is the basis for all public health intervention, and urging a greater international response. And that really started to bear some fruition about 15 years ago when WHO responded, and later the UN Security Council passed a resolution calling for protection for healthcare and accountability for the perpetrators. So it's been a long road, but unfortunately, the problem continues, and in some ways, at least in recent years, has gotten much worse.
In all these years of advocacy, what is the core argument that you're making about why people should be paying attention to this issue?
The fundamental issue is that we know that people's health, people's well-being is an essential aspect of the whole global health enterprise. And also the protection is based on the principle of humanity, that everybody who's suffering unnecessarily should be protected. Healthcare needs to be respected. And that idea of protection goes back more than 150 years. The very first Geneva Convention focused exclusively on protection of wounded soldiers in war. And ever since, the protections have expanded, that now include civilians, civilian hospitals, health workers, and others.
So, in this British Medical Journal article, you are in fact quoted saying this is a disturbing trend, that the number of attacks are increasing. Talk to me about what you're seeing.
The first thing is the sheer number. The Safeguarding Health and Conflict Coalition, which I chaired for many years, issues a report on global trends and annually. And in 2024, there were more than 3,600 incidents that we documented in around 23 countries. It's a staggering number when you think about what the impact of every single attack is likely to have, decreasing access, causing traumatic injury, and having much longer-term effects in terms of service availability. So that's just the sheer number is extraordinary. But we're seeing other trends as well. First is we're seeing increasing use of explosive weapons against hospitals, including drones. As drones become more available, they're being used to attack hospitals. Second trend is some years ago, the majority of attacks were committed by non-state armed groups, these rebel forces of various kinds. But that's changed. That switched. Now it's state actors who are the predominant perpetrators, whether it's state militias, conventional armed forces, or other state-affiliated organizations. Another trend is the dramatic increase in the number of health workers killed around the world. The numbers, more than 100 have been killed in Gaza, Ukraine, Sudan, Myanmar in recent years. And people don't know that more than 400 health workers were killed in Lebanon in 2024 in a very short period of time. Recently, last month, in fact, there was the worst attack I've ever seen or heard about against the hospital, where in Darfur, the rebel group, the RSF, attacked a hospital in Darfur, killing, according to the UN, more than 600 people. A stunning, stunning number.
Wow. Where in the world right now have we been seeing these attacks?
They have occurred wherever there is war. We can't find a conflict where there aren't attacks. In recent years, the number of attacks in Gaza, in Ukraine, in Sudan, in Myanmar have been the highest. But there are also attacks in other countries, whether it's Central African Republic, which no one knows about, or the Democratic Republic of Congo and Colombia. So they really take place wherever there is war, and of course, some places more than others.
You mentioned that so many of these attacks are now being perpetrated by state actors. What is their justification? What do they say about why they are attacking healthcare?
Sometimes they don't say anything at all, but what we do know is there are multiple reasons why hospitals and other health facilities are attacked. One is it's part of a generalized attack on civilians. We see this in Darfur, we see this in Ukraine, where the Russians are attacking the power grid, they're attacking apartment buildings, where they're trying to convince the Ukrainians that it's futile to oppose Russia. In some places, like in Gaza, there's a claim that hospitals are being misused by Hamas. But even if that's the case, there are protections required to make sure that patients and infrastructure are not totally destroyed. And these protections are like precautions that are required to minimize harm to civilians, which are completely neglected or abandoned. That's another reason. Sometimes there are tactical reasons. The hospital or facility is in a place that has some military interest, and the military objective takes priority over protection, which is not permitted under the law. So we have many, many reasons. But what we know is that these attacks are committed with impunity, and that tends to create a permission structure for more attacks.
I want to ask you about that. What has the accountability been like for people who are violating human rights by attacking healthcare in these illegitimate ways?
First, to know attacking a hospital is a war crime. And if it's part of a pattern, it's a crime against humanity. So it's a crime. And yet, there's been no accountability for those crimes. And there have not been cases brought that principally focus on violence against healthcare by the International Court, Criminal Court, or its predecessors going back to the war in former Yugoslavia. So the fact that there is no legal accountability is a huge problem. There's also no political accountability, which may be the most powerful weapon, as it were, in stopping them. That is, that governments that provide weapons or diplomatic, economic, or other forms of political support have influence over the perpetrators, and they don't use them. So I think this problem of lack of accountability is the overwhelming reason why they continue.
You're painting a grim picture. More attacks than we've seen in recent years, the involvement of state actors, a lack of accountability. What needs to happen for this trend to reverse?
There are a number of things. One is a political commitment to stop these. And there are some interesting developments in that area. For example, the International Committee of the Red Cross has an initiative to increase those political commitments to the law. I think that's an important development. The Safeguarding Health and Conflict Coalition goes a step further. That is to end impunity. And this issue will be coming up again in the UN Security Council next spring because it's the 10th anniversary of a resolution calling on states to comply with the law. The prospects for that resolution are uncertain because anything that is strong is likely to be vetoed by Russia or the United States. Even so, there is a sense that the occasion of this review can increase commitments to accountability. Also, what could happen is the health community writ large, the public health community, the medical community, nursing community, has to speak out. And we have some good examples of that. The British Medical Association has been very outspoken on this issue, writing reports, devoting its journal to many articles about it. But here in the United States, the medical and public health groups are mostly passive. And I think that needs to change. They need to step up as a form of solidarity to protect their colleagues and protect all the patients who are in need.
Len, what's at stake on this issue as you think back to your many years working on it and you look ahead?
What is at stake is the safety, the health, the well-being, the lives of people who are wounded and sick in war and their caregivers. That is what is at stake. And there are millions of them whose lives are at stake. We can't underestimate that when we look at the impact of the attacks in these wars and the decrease in access to healthcare, the traumatic injuries, the malnutrition, all the other aspects that are consequences of these attacks. We have to act if we believe in public health, which of course is so essential.
And Rubenstein, thank you so much for joining me today.
Thank you.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmond. Audio production by J.B. Arbogast, Michael Bonfils, Spencer Greer, Matthew Martin, and Philip Porter, with support from Chip Hickey. Distribution by Nick Moran. Production coordination by Catherine Ricardo. Analytics by Elisa Rosen. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.